Hello, everybody, and welcome to our Mountain Talk. I'm Jennifer Cunningham. I'm the AVP of Alumni Relations, and I'm here with Dr. George DuPaul, a PhD and professor of school psychology at our College of Education here at Lehigh. Just a few pieces of choreography before we get started to make the webinar as productive and enjoyable as we can. We're going to go till about 12:30. Dr. DuPaul is going to speak for 5 to 10 minutes. He's got some slides here that he'll show you, and then we'll open it up for your questions. The way you ask those questions is right at the bottom of your screen. You should see a little icon that says chat with a little comics bubble. Just hit that and a screen will appear, a little pop-up, and you can just type your message where it says type your message here. You can choose to do all panelists and attendees so that everybody can see your question, or you can just do all panelists. And I will read the questions to Dr. DuPaul as we go along. And the success of these webinars really does depend on your questions. Otherwise, it'll be me interviewing, which is also fascinating because the topic today is really fascinating, but I do encourage you to ask your questions. We are recording, so if you have to drop off early or want to review the material after, we will also send you a link to that. And after, we will also send you a survey to get your feedback. We do these a few times a month, but I feel like every one we do gets a little bit better because participants give us feedback on what's worked, what hasn't worked, what kind of topics they enjoy. Clearly, this is one of our most popular. We had almost 400 people register for this. And what we find is that people will register and then watch the recording later. So right now there are about 32 of you on the call. So I hope you all enjoy this half hour. All right, let's get started. Dr. DuPaul.
Great. Thanks, Jennifer. I appreciate it. And I appreciate everybody's interest in this topic, and welcome you all to this. The focus of my talk, as you probably are aware, is on treatment of ADHD and in particular treatment of ADHD beyond medication. And there's three things that I'm going to quickly cover before getting to your questions. One is giving everybody kind of an overview of what ADHD is and how it manifests itself and why it's a challenge for us in our society today. Secondly, the kinds of treatment approaches that folks can take, including some of us here at Lehigh. And then thirdly, finishing with a discussion of the kind of research that myself and my colleagues and students have been engaged in over the past 25 years, actually, here at Lehigh. So the first thing that we should talk about is what is ADHD. And ADHD, by the way, stands for Attention Deficit Hyperactivity Disorder. And it's gone by a number of names over the years: hyperactivity, hyperkinesis, attention deficit disorder, ADD, ADD with hyperactivity, ADD without hyperactivity. These are all synonyms for what is presently called attention deficit hyperactivity disorder. And it describes individuals, not just children, but adults as well, who have significant problems in two main areas. One is inattention, and the other is hyperactivity impulsivity. So for example, in the inattention domain, what we're talking about are children who have difficulty sustaining their attention to effortful tasks like schoolwork or chores at home, that kind of thing. They have problems getting those assignments or work done in a reasonable amount of time. Distractibility, problems forgetting things, and a lack of focus, if you will. And the hyperactivity impulsivity part of the disorder involves high activity level, such as fidgeting frequently, a lot of restlessness, maybe even at younger ages getting out of their seat without permission, high level of talkativeness, or chatterbox is the term that some people use colloquially about this. And then on the impulsive side of things, acting quickly without thinking, doing things without considering the consequences, barging into other people's activities, impulsively calling out in class without permission, those kinds of things. And the thing that you're probably reacting to as I describe this is that this probably that sounds like it could describe every child in every situation. And it is true that all of us, including adults, engage in some of these behaviors from time to time. What separates people with ADHD from their peers, though, is that this is a set of behaviors that happen at a very high frequency. So on not only a daily basis, but frequently throughout the day. It's chronic. So these are difficulties that typically are going on across years, not just prior to holiday break or summer vacation or other times when everybody in the school seems to have ADHD. This is something that's chronic throughout the school year and throughout the calendar year. It carries across situations, particularly at home and at school. Both parents and teachers will see these behaviors. And very key concept here is that it has to impair their functioning. In other words, the problems with attention and hyperactivity, impulsivity need to lead to difficulties academically, socially, or in the case of adults, keeping a job. And so that is really what separates people with ADHD from their peers, is that impairment piece. About 8% of children in our country right now are diagnosed with ADHD. And actually 11% of kids in this country have been diagnosed with ADHD at one point or another in their lives. So we're talking about almost 1 out of every 10 kids may be eligible for this diagnosis, which means it is one of the highest frequency disorders that we deal with right now. Much more frequent than autism, for example, or other conditions that you may be aware of. It affects more boys than girls, probably anywhere from 2 to 1, 3 to 1 boys to girls, although there are a lot of times girls with ADHD don't get identified right away because they're not as aggressive or frankly as obnoxious as boys with ADHD, and so they sometimes fly under the radar. But nevertheless, it does affect boys more than girls. It also tends to come with other disorders. In other words, it's rare for ADHD to be there by itself. It can be also associated with conditions like learning disabilities. About 30% of the cases have a learning disability. Almost 50%, particularly boys with ADHD, will have what's called oppositional defiant disorder, which involves frequent non-compliance, defiance, and temper tantrums. It can also be associated with anxiety or depression disorders, particularly, I'll talk about this in a few minutes, some of the research that we're doing on college students with ADHD, many of them have either an anxiety disorder or depression on top of their ADHD. And of course, that complicates treatment, not only in terms of medications, but also other types of treatment that we might use when ADHD is manifested with other disorders. And finally, in terms of an overview here, this is a disorder that's very costly to society in terms of resources and lost productivity. In fact, research that's looked into this has indicated that up to about $50 billion annually is associated with treatment of this disorder and lost productivity due to this disorder. So this is not a benign kind of thing where, a boy who's highly active and inattentive gets into trouble occasionally. That's not what we're talking about here. We're talking about individuals who have chronic problems in these areas that's very impairing and very costly. And so what do we do about this? How do we treat ADHD? And the most common treatment is medication, in particular stimulant medications like Ritalin or Dexedrine or Adderall, and Concerta was another example I was going to throw out there. And those medications are very helpful in terms of for about 60 to 70% of kids with ADHD will respond positively, where they'll have less problems with attention and less problems with impulsivity. But the medication doesn't teach children anything. It puts them in a position to learn. That's the best part about medication when it's working, is that it puts them in position to benefit from other treatments. And so we often talk to parents and teachers about the fact that we can't just rely on medication alone. that it needs to be supplemented with other treatments in order to really get the best bang for your buck out of medication. And that's really where our focus has been here at Lehigh. And on this slide, I'm giving you some examples of some of the major areas that we look at. Behavioral intervention at home, where we help parents to implement strategies at home that we can talk about if you have questions. In particular here, at Lehigh, we've been focused on early intervention for young kids, 3 to 5-year-olds who might be at risk for ADHD. And we really don't want to get into medication too soon with them. And so we try to work with the parents to help them at home. Similar kind of set of strategies focused on reward systems and other ways to work with them at school, as well as focusing in on the areas of academic concern that they may have. As I mentioned to you a few minutes ago, some of these kids may have learning disabilities, or even in the absence of learning disabilities, have problems academically. And so we need to focus on how do we provide that kind of support, as well as in the area of social relationships. These are kids who have problems making and keeping friends. And so how do we help support that? Medication can help with some of these things, but as I mentioned to you a few minutes ago, the primary benefit of medication is to put them in position to benefit from other forms of intervention. So the last piece that I want to mention before getting to your questions is the research that we've been doing at Lehigh. I've been at Lehigh now for 26 years, and over that course of time, we've completed a lot of research projects that look at how do we build on medication, or how do we design interventions that might take the place of medication. We have also done some research on assessment measures to identify kids with ADHD, but most of our research is focused on interventions to support these kids, particularly in school settings, which are very, very difficult settings for individuals with ADHD. We couldn't design a worse environment for kids with ADHD than a typical classroom, just because it requires sustained attention and control of behavior that these kids struggle with. So you see here on the slide a listing of the kinds of areas that we've delved into. I won't describe each of these in detail in the interest of time, but right now the primary projects that we have going on right now are a focus on excuse me, helping parents of young kids with ADHD to help them be ready for school, essentially, to be ready to enter elementary school in terms of self-regulation and early academic skills. So we have a number of research projects ongoing in that area, including the use of technology to help parents with these strategies, to prompt them to use strategies in certain situations through the use of a mobile app. The other major research project that we have ongoing right now is we're doing a study of intervention for high school students with ADHD. It's actually the single largest study of high school students with intervention for high school students with ADHD ever conducted. And so we're working in a number of the schools here in the Lehigh Valley in terms of supporting 9th, 10th, and 11th graders with ADHD and their families to help them do better academically and socially. So I will stop at that point and see what kind of questions you all have.
Great, thank you. Yes, we have a question from Caroline. She says, my son is 11. What types of behavioral interventions would you recommend? After a year and a half, we finally decided to medicate him during school time because his learning was impacted, but at home he isn't medicated. What should we do behavior-wise? Yeah,
so there, the medication, as this question points out, the medication doesn't cover 24/7, 365. It's not active the entire time that the child is awake and doing things, particularly at home. And so the strategies that we've focused on with families in this area are what are referred to as behavioral strategies, behavior management strategies. And that involves typically identifying the behaviors that we want the child to exhibit at home, whether that be doing homework or chores or following through on instructions, and then rewarding or reinforcing that through praising the child and giving them feedback about specifically what they have done well, as well as tying those behaviors to access to privileges, to things that they prefer to do in the home, And people sometimes question that and say, isn't that bribery or that kind of thing? And it really is not, in the sense. I mean, if you look up bribery, technically bribery is paying somebody to do something illegal. We're not talking about illegal activities here. And the other thing is that kids with ADHD very much live in the now. They live in the present. They're not considering the consequences of their behavior down the line. And so what we need to do is try to build in immediate feedback and immediate consequences, so they are aware of their behavior, are aware of the impact of their behavior. And over time, they can become what we refer to as intrinsically motivated, that is self-motivated. But they're not going to be initially self-motivated. They're living into the immediate payoff of what they're doing. And so not really considering the long-term consequences. So we're trying to build strategies at home to help them learn to connect their behavior to consequences, and in particular long-term consequences.
Yeah. Lots of questions here. This is great. And for those of you who are considering a question, again, the chat is at the bottom of the screen. If you're on a mobile device, you may have to hit more to find the chat box. So a question from Fred. Do you treat AD only different from ADHD?
Okay, yeah, so ADHD only, I'm assuming that what Fred is referring to is what's called ADHD predominantly inattentive type, which we used to call ADD without hyperactivity, meaning that the child only has problems with the attention domain, that they're not hyperactive and impulsive, versus the full, what's called a combined presentation of ADHD, which is inattentive and hyperactive impulsive. Interestingly, the medication side of things, the medications that work for the combined presentation also work for the inattentive presentation. So on the medication side of things, your Ritalins and your Dexedrines and your Adderalls are going to be helpful for people with ADHD, predominantly inattentive type. On the behavioral side of things, again, we do look to prompting and reinforcing strategies, as I was just describing, for individuals with ADHD, predominantly inattentive. But typically the targets of what we're looking at are different. For kids that have primarily inattentive problems, we're really much more focused on completion of tasks, focus on tasks, and maybe even identifying if they have some skill deficits, if they have some reading problems or math problems, which can be correlated frequently with inattentive presentation. As opposed to targeting aggression or noncompliance and disobedience, which is more frequently something that we encounter with ADHD combined presentation. So the short answer to Fred's question is that the treatment approaches are very similar, but the focus of what we target in terms of the challenges that the kids experience are going to be slightly different.
Okay. So the next question is about diet from E. Perlina. Are there any diets or foods that have been linked to improving ADHD symptoms? And I have a addition to that, things like meditation or yoga or other kinds of more holistic kind of treatments. She also asks, is there any linkage between ADHD and OCD behaviors?
Okay, there's a lot there to unpack.
Yeah.
Well, with the diet, the short answer to the diet question is there are a very small percentage, a very small minority, in the single digits now, of kids with ADHD, predominantly younger kids with ADHD, who may respond to restricted diets. That is, diets that restrict them from food additives or other artificial ingredients and sugars to some extent. But for the vast majority of kids with ADHD, particularly older kids with ADHD, the diet is not going to directly address their symptoms. Now, I should say that, obviously it's always a good idea to have kids on balanced diets, and restricting sugar as much as you can is going to be a great idea. But basically what that results in is you have a healthy child with ADHD. A physically healthy child with ADHD with a balanced diet. That's great, but it's not going to directly address their symptoms. People have looked at other things like omega-3 fatty acid supplements and other things along those lines. And there's some evidence that the omega-3 approach could help some kids, although much more controlled studies need to be done in that domain. My advice to parents is to try to set up diet as you would with any other child, to have a balanced diet, restrict the sugars as much as you can, and go from there. Because there is this, she didn't ask this, but there is a higher risk for kids with ADHD to develop obesity, in part because it's an impulse control problem. And so overeating can take place.
It's the opposite if kids are so.
Yeah, you would think, you know, they're hyperactive, they'd be burning an awful lot of it, but there is a higher prevalence of obesity among ADHD kids. In terms of OCD, I think was one of the parts of the question. That's obsessive compulsive disorder. Kids with ADHD are at no higher risk for obsessive compulsive disorder. They are at higher risk for anxiety disorders in general, but not the specific anxiety disorder of OCD. In fact, we would like to have them have a little bit of OCD. Sometimes in terms of being, you know, attention to detail is often something that's missing from, you know, for many of these kids. Yeah. There was another piece to her question.
Well, I was asking meditation and yoga and things like that.
Yeah, people have started to look at that, meditation and yoga and other types of mindfulness training for kids with ADHD. There's some interesting open trial, that is no control group kind of thing, research that's been done there, that it could lead to some promising results, but we need much more controlled research. And the biggest issue that, and this could tie into other questions about specific types of treatments, but treatments that are delivered away from what we call the point of performance have usually more limited benefit. The point of performance, by that I mean the point of time and the setting where the problems are happening. So if we're trying to impact a kid's behavior in math class, which happens, you know, Monday through Friday morning in a particular classroom, meditation experience or yoga experience on Thursday, Tuesdays and Thursdays, or talk therapy sessions on Wednesday afternoons with a counselor, those kinds of things have much less impact on that point of performance. And so what we need to be thinking about are what are strategies we can be implementing in math class Monday through Friday in that classroom. Those are the interventions that are going to work best.
Okay. Great. Let's see. From Marianne, have your studies included, meditation, she just asked that. She says, I find it works wonders with my son and myself. Meditation is simple, has only great side effects, and is often passed over.
Yeah, I mean, it's kind of in the same domain as diet. I mean, meditation is good for people in general, right? Yeah. So I think for kids who may be excitable and prone to, you know, emotional response, having that, you know, ability to engage in meditation and mindfulness is really helpful. Is it going to impact their symptoms to a degree that we don't need other interventions? I doubt it, but that's, you know, something that more research can help us to decide.
Do you have any concerns? This is from Jay Nalrock. Do you have any concerns on the long-term use of ADHD medications in children?
Yeah, the only long-term side effect that has been identified for the stimulant medications like that I've been listing for you earlier, Adderall, Dexedrine, so forth, is impact on children's growth. And their physical growth, height and weight, can be impacted by these medications. And so sometimes what happens is we take kids off medications during summer vacations or school vacations because they have what's called a growth rebound effect. So, you know, that's really the only long-term effect that's been identified. The nice thing about stimulant medications is that they're eliminated from the body within 24 hours. They don't build up in any organ system. And so typically it's not really an issue. The other thing that people are afraid of is the potential for addiction. And the interesting thing here is that most of the studies on this have shown that kids who are medicated with ADHD are actually less likely to engage in recreational drug use and addictive type behaviors than kids with ADHD who haven't been treated with medication. So it doesn't seem to be a risk indicator for, addiction down the line. I think the biggest challenge with medication, the biggest drawback to it, is it doesn't teach kids anything. It basically gets them in position to learn. And so we always need to be thinking about what do we do instead of medication or in addition to medication.
Ferdinand Homefolder, interesting name. When will executive functioning be used to assess kids in high school who have no behavioral issues but do not complete their assignments?
Yeah, so executive functioning refers to planning, organization, those kinds of functions of the brain. And as you might imagine, individuals with ADHD have executive functioning deficits, in particular at high school level. So the kids that we work with in our current project, we're focused on helping them to track their assignments on a regular basis, to organize their materials, which, their book bags are just ridiculous in terms of, papers from 3 years ago still in their book bags. Their binders are not, folders are not organized. They don't manage their time well. And so we really focus on coaching them essentially to use their planner. We do organization checks of their binder and their book bags and everything on a regular basis. And we help them to plan out their time. So it's a key piece of the treatment of adolescents with ADHD. And many of the things that we call executive functioning deficits are symptoms of ADHD. So difficulty sustaining attention to tasks over time, for example, are highly correlated with what we call executive functioning deficits. So I'm not sure exactly where the question's going there, but clearly executive functioning is already being considered as part of the diagnostic workups that we do, and more importantly is a focus of the treatment that we engage in.
All right, we have time for one more question. From Caroline, why are kids with ADHD able to focus so long on video games and nothing else?
That is a really, really good question. Yeah, and the key thing there is that kids with ADHD, if they're interested and motivated by a particular activity or task, they can sustain attention to it, as well as other kids. And although there actually has been some studies looking at the video game performance, believe it or not, of kids with and without ADHD, and kids with ADHD don't do as well in general. They're not as competent on video games, perhaps because their attention is not as good. But anyway, that's an aside. I think what this question gets at is the frustrations that we can have as parents and teachers of why can you focus on this for hours on end, but you can't do a math assignment for 5 minutes, or you can't clean your room for 10 minutes. And a lot of that has to do with the motivation piece, quite frankly, and I don't want to get too deep in the weeds here because we're running out of time, but there actually physiologically are changes at the brain level when we're interested and motivated by something that kind of overrides some of the sustained attention problems that these kids have. And that comes back to, why do we set up reward systems for these kids? Because it increases the motivational value and the interest value of the task, at least temporarily, so that they're able to sustain attention. So it's kind of like we set up strategies that make life more like a video game. As a way to connect it to this question, is we want to make the mundane things that we ask the kids to do more interesting and motivating to them, and they will be able to sustain their attention to it. So it has to do with the impact of motivation and interest on brain functioning, and that's why these kids look different under those circumstances.
Well, this has been fascinating. Thank you so much. I was glancing through the other questions. We still had quite a few questions to go. And a lot of them are kind of specific to kids, or specific questions. It sounds like maybe there are some folks on the webinar that have kids or suspect kids, or maybe they're teachers. Does Lehigh have, so this is probably the last question, does Lehigh have resources locally? Like if people who live local or in Philly come to Lehigh, are there studies or things that their children can get into, or are there resources here, seminars that are regular?
Yeah, no, presently we're not recruiting for any studies, unfortunately. I would like to say we are. There are certainly many professionals here in the Lehigh Valley that work with kids with ADHD, some of whom are graduates of our program here that we can refer to. And I also, if you, we have a website that's related to what's called Project PEAK, P-E-A-K. That is our focus on early intervention, and we have links to resources there for parents of young kids with ADHD. And finally, I would say, just to put in a plug, there is a national website, help4adhd.org, and the 4 is a numeral, so it's HELP, the numeral 4, ADHD.org, and that's run by the CHAD organization, which is for parents and teachers of ADHD, and it has excellent evidence-based strategies and resources on that website.
Great, and we'll send those links out to everybody. They're actually on the chat now, but we'll also send them in the email. So again, thank you so much. I know it's the very end of the semester, and it's probably a really busy time and exciting with graduation coming up.
Yes.
So thank you so much, and thank you to everybody. We I think saw up to 55 people that were on the call. So
great.
Thank you, and have a good day, everybody. Bye-bye.
Thank you.